Gentlemen, let me ask you something direct. Have you ever been told that the secret to better blood flow down there is all about pills, pumps, or expensive treatments? I'm here to tell you that advice may be keeping you stuck. What if I told you there's a specific pressure point on your hand, a spot you can press right now that can trigger increased blood flow to your penis within minutes? Not hours, not days, minutes. Now, I know that sounds almost too simple to be true, but this isn't some internet gimmick. This is based on ancient acupressure techniques combined with modern vascular science. And by the end of this video, you'll know exactly where this point is, how to activate it properly, and why it works even if you've struggled with weak erections for years. But here's what most men don't realize. This pressure point is just the beginning. There are actually 3 hand points that, when pressed in the right sequence, can create a cascade effect that floods your pelvic region with oxygen-rich blood. The 3rd point is the most powerful, and I'll reveal that one last, because once you combine all 3, the results can be dramatic. I'm Dr. Emily Carter, and I've spent over 25 years specializing in men's health and urology. I may not be a man myself, but I've listened to thousands of men in their 60s, 70s, and beyond tell me about their frustrations, their embarrassment, and their hope for solutions that actually work. And what I'm about to share with you today has helped many of my patients experience immediate improvements in sensation, firmness, and confidence. Now, I want you to have value right away, not at the end. So let's start with the first pressure point. Look at your left hand right now. Find the webbing between your thumb and index finger. That soft, fleshy area right there. In traditional Chinese medicine, this point is called Li4, or large intestine 4. But from a urological perspective, this point connects to a network of nerves that influence circulation throughout your entire body, including your pelvic region. Here's how to activate it properly. Take your right thumb and place it on the webbing of your left hand, right in that meaty part between the thumb and index finger. Press firmly, not gently. You should feel a dull, spreading ache. That's exactly what you want. Now, hold that pressure for 30 seconds while taking slow, deep breaths. What's happening physiologically is fascinating. When you apply pressure to Li4, you're stimulating the release of endorphins and triggering a parasympathetic nervous system response. This causes blood vessels throughout your body to dilate, including the delicate arteries that supply your penis. More dilation means more blood flow. More blood flow means better, fuller erections. But here's where most men get it wrong. They press too lightly, or they don't hold it long enough. You need sustained, firm pressure for at least 30 seconds to activate the full response. Before we continue to pressure point number 2, let me quickly explain why you should trust what I'm telling you. My name is Dr. Emily Carter. I've been a board-certified urologist for over 25 years. I've treated thousands of men dealing with erectile dysfunction, weak blood flow, prostate issues, and declining sexual performance. I've seen what works and what doesn't. I've studied both Western medicine and complementary approaches like acupressure, and I can tell you with absolute certainty that these techniques, when done correctly, can produce real measurable results. This isn't theory. It's backed by clinical studies showing that acupressure can improve vascular function, reduce stress hormones, and enhance erectile quality. And more importantly, it's backed by the real-world results I've seen in my own practice. Before we go further, if you're finding this information helpful, do me a favor. Hit that subscribe button right now and turn on the notification bell. I release videos like this regularly with science-backed strategies specifically designed for men over 60. Real solutions, not hype. And make sure you comment below and let me know where you're watching from. I love hearing from viewers all around the world. Are you watching from the United States, Canada, the UK, Australia? Let me know in the comments right now. Now, let's continue with pressure point number 2, because this one targets a completely different pathway. Pressure point number 2 is located on your wrist. Look at the inside of your left wrist, right where you'd check your pulse. About 3 finger widths down from the crease of your wrist, right in the center, you'll find a tender spot between 2 tendons. This is called pericardium 6, or P6. Now, you may be wondering, what does my wrist have to do with blood flow down there? That's a fair question. Let me explain. P6 is directly connected to your cardiovascular system. When you stimulate this point, you're influencing heart rate variability, blood pressure regulation, and overall circulation. Think of it like adjusting the thermostat in your house. You're not heating individual rooms, you're changing the entire system. Here's how to activate P6 properly. Take your right thumb and press firmly on that spot, 3 finger widths below your wrist crease, right between the tendons. You'll feel a slight ache radiating up your forearm. That's the nerve pathway being activated. Hold this pressure for 45 seconds while breathing deeply and slowly. Let me share a story. A gentleman I'll call Richard came to me at 68. He told me he hadn't had a reliable erection in over 3 years. He'd tried pills, but they gave him headaches and didn't always work. His wife was patient, but he could see the disappointment in her eyes. He felt like less of a man. So I taught him these pressure points. I gave him a simple protocol. Press Li4 for 30 seconds, then P6 for 45 seconds, twice a day, once in the morning and once before bed. Within 2 weeks, Richard came back to me with tears in his eyes. He said, "Doc, I didn't think it was possible. I'm waking up with morning wood again, not every day, but 3 or 4 times a week. I feel like I'm getting my life back." Not only was his erectile function improving, but his overall energy and mood were better too. His wife noticed the difference. That's the kind of turnaround I see regularly when men commit to these techniques. Now, let me explain the science behind why this works so well, especially for men over 60. As you age, your blood vessels naturally become less flexible. The endothelial cells that line your arteries don't produce as much nitric oxide, which is the key molecule that causes blood vessels to relax and expand. Less nitric oxide means less blood flow. Less blood flow means weaker erections. But here's what's fascinating. Acupressure doesn't just temporarily increase blood flow. It actually stimulates your body to produce more nitric oxide naturally. When you press these specific points, you're sending signals through your nervous system that tell your endothelial cells to wake up and start producing more of this critical molecule. Think of it like a radio. Your blood vessels are the speakers. Nitric oxide is the volume knob. As you age, someone's been slowly turning that volume down. Acupressure turns it back up. From a urological perspective, the penis contains delicate erectile tissue called the corpus cavernosum. These are 2 cylindrical chambers that run the length of your shaft. When blood flows into these chambers and fills them completely, you get a firm, lasting erection. But if blood flow is restricted, those chambers only partially fill, resulting in weak, unreliable erections. By stimulating Li4 and P6, you're increasing overall circulation and specifically targeting the arteries that feed your pelvic region. More blood reaches those chambers. They fill more completely. You get better erections. Now, I know some of you are thinking, if it's this simple, why didn't my doctor tell me? Fair question. The truth is, most conventional doctors aren't trained in acupressure or complementary medicine. They're trained to prescribe medications and perform procedures. There's nothing wrong with that. but it means many doctors simply don't know about these techniques, or they dismiss them because they're not pharmaceutical solutions. But I've been in this field long enough to know that the best approach is often a combination. Use what works. And if pressing a few points on your hand can improve your blood flow without side effects, without cost, and without risk, why wouldn't you try it? If you're still with me and finding this valuable, make sure you've hit that subscribe button. I don't want you to miss my next video where I'll reveal the 3 common medications that secretly destroy erectile function. Even your doctor might not warn you about these. It's information that could change everything. Now, let's talk about pressure point number 3. This one is the most powerful of all. Pressure point number 3 is located on the back of your hand. Make a fist with your left hand and look at the back. See the highest point where your index finger knuckle meets the back of your hand. Right there, in that little depression just behind the knuckle, is a point called LI3, or large intestine 3. This point is directly connected to your lower abdomen, your pelvic floor, and your sexual organs. In traditional medicine, it's known as one of the most powerful points for enhancing male vitality and sexual function. Here's how to activate LI3 properly. Take your right thumb and press firmly into that depression on the back of your left hand, right behind the index finger knuckle. You should feel a deep, radiating sensation. Some men describe it as a dull ache that spreads down into the palm. Hold this pressure for a full 60 seconds while breathing slowly and deeply. Now, here's where it gets interesting. When you combine all 3 points in sequence, you create what I call the triple flow protocol. You're not just increasing blood flow from one pathway. You're activating 3 separate nerve networks that all converge in your pelvic region. The result is a flooding effect. Blood rushes in from multiple directions, filling your erectile tissue more completely than it has in years. Let me share another story. A gentleman I'll call Michael came to me at 72. He told me he'd given up on sex entirely. He said, "Doc, I'm old. I thought this part of my life was just over." His wife had stopped initiating intimacy because she didn't want him to feel pressured or embarrassed. I taught Michael the triple flow protocol. Press LI4 for 30 seconds, then P6 for 45 seconds, then LI3 for 60 seconds. Do this twice daily, morning and evening. I also told him to do it 15 minutes before any intimate activity. Within 4 weeks, Michael came back with a completely different energy. He said, "I can't believe I'm saying this at 72, but I'm having sex again, real sex. And it's good. My wife is thrilled. I feel like a man again, not just an old guy waiting to die." That's at 72. If Michael can do it, so can you. Now, I need to warn you about something important. There are 3 common mistakes men make with acupressure that can actually sabotage your results. If you're making these mistakes, you might be undoing the very benefits you're hoping for. Mistake number 1 is pressing too lightly. I see this all the time. Men are afraid of hurting themselves, so they barely touch the pressure points. But you need firm, sustained pressure to activate the nerve pathways. It should feel like a dull, spreading ache. If you're not feeling that, you're not pressing hard enough. Mistake number 2 is not breathing properly. When you press these points, your body naturally wants to tense up. But tension restricts blood flow. You need to breathe slowly and deeply, in through your nose and out through your mouth, to keep your body relaxed and your blood vessels open. Mistake number 3 is expecting instant miracles without consistency. Yes, you may feel immediate effects, especially increased warmth or tingling in your pelvic area. But the real lasting benefits come from doing this twice a day, every day, for at least 2 to 4 weeks. Your body needs time to reset its circulation patterns. And here's something critical. If you have severe cardiovascular disease, uncontrolled high blood pressure, or you're on blood thinners, talk to your doctor before starting any new technique, including acupressure. This is generally very safe, but I always want you to be cautious and informed. Here's the right way to put this into practice. I call this the triple flow protocol. Step 1. Find a quiet place where you can sit comfortably for 5 minutes without interruption. This works best when you're relaxed, not rushed. Step 2. Start with your left hand. Locate Li4, the webbing between your thumb and index finger. Press firmly with your right thumb for 30 seconds. Breathe slowly and deeply. You should feel a dull ache spreading through your hand. Step 3. Move to P6 on your left wrist. 3 finger widths below the wrist crease, right between the tendons. Press firmly for 45 seconds. Again, breathe slowly and keep your body relaxed. Step 4. Finish with Li3 on the back of your left hand, in the depression behind your index finger knuckle. Press firmly for 60 seconds. This is the most powerful point, so give it the full time. Step 5. Repeat the entire sequence on your right hand. Li4 for 30 seconds, P6 for 45 seconds, Li3 for 60 seconds. The entire protocol takes about 5 minutes. Do this twice a day, once in the morning and once in the evening. For maximum effect, do it 15 minutes before any intimate activity. Simple, precise, effective. If you do this consistently, you may notice subtle changes within a week. Increased warmth in your pelvic area, more frequent morning erections, better sensation during intimacy. By weeks 3 to 6, most men start experiencing real physical changes: fuller, firmer erections, better stamina, more confidence. Here's something quotable you'll want to remember. Weak erections are not a sign of old age. They're a sign of poor circulation. And circulation is something you can improve at any age. Your age does not define your vitality. Your choices do. If you're not using acupressure to enhance blood flow, you're fighting your body's natural healing capacity instead of harnessing it. Now, let's address a concern some of you may have. Can I just take a pill instead? Isn't that easier? It's a fair question. The truth is, medications like Viagra or Cialis can be effective for many men, but they come with side effects: headaches, flushing, nasal congestion, vision changes, and they don't address the root cause of poor blood flow. They're a temporary fix, not a long-term solution. Acupressure, on the other hand, has 0 side effects. It costs nothing. You can do it anywhere, anytime. And it actually improves your body's natural ability to produce nitric oxide and maintain healthy circulation. Another common question: how long until I see results? Most men notice something within the first week. Maybe it's just increased warmth or tingling in the pelvic area. Maybe it's better morning erections. But the real significant improvements usually happen between weeks 3 and 6. Your body needs time to reset its circulation patterns and rebuild vascular health. And here's the best part: the benefits are cumulative. The longer you practice the triple flow protocol, the better your results become. You're not just masking symptoms. You're actually healing your vascular system from the inside out. Imagine waking up tomorrow morning with a firm, reliable erection. Not because you took a pill, not because you used a device, but because your body is functioning the way it's supposed to. Imagine going into intimate moments with confidence instead of anxiety, knowing that your body will respond, knowing that you can perform, knowing that you're still a vital sexual man, regardless of your age. Imagine your partner looking at you with desire again, not pity. Imagine the pride you'll feel when you realize you've taken control of your health and reclaimed this part of your life. That's not a fantasy. That's the reality many of my patients are living now, and I want you to have the same. Let me share one more story. A gentleman I'll call James came to me at 76. 76. He told me, "Doc, I haven't had sex in 8 years. My wife and I are more like roommates than lovers. I thought that part of my life was gone forever." James had tried pills, but they didn't work consistently. He'd tried pumps, but they were awkward and killed the mood. He was ready to give up entirely. I taught him the triple flow protocol. I told him to practice it twice a day, every day for at least 4 weeks. I also gave him some additional techniques for pelvic floor exercises, which I'll cover in a future video. 6 weeks later, James came back to my office with his wife. They were both glowing. He said, "Doc, I don't know how to thank you. We made love last night for the first time in almost a decade. Real love. It wasn't perfect, but it was beautiful." My wife cried afterward, and so did I. We felt connected again, like we did 40 years ago. That's at 76. If James can reclaim his sexuality and his connection with his partner at that age, then you absolutely can too, no matter where you're starting from. So here's my invitation. If this message spoke to you, if you want real science-backed methods that are designed specifically for men over 60, then subscribe right now. Hit that button and turn on notifications, because you don't want to miss what's coming next. And I want you to look forward, because in my next video, I'm going to reveal the 3 common medications that secretly destroy erectile function. Blood pressure meds, antidepressants, even some over-the-counter drugs you've been told are safe. When you see that list, you'll understand why so many men stay stuck and how avoiding them or finding alternatives can unleash your vitality even further. Make sure you're subscribed so you don't miss it. Now, let me make a challenge for you. Try the triple flow protocol for just 2 weeks. Press Li4, P6, and Li3 twice a day, every day for 14 days. Then come back to this video and comment below. Tell me what you noticed. Did you feel more warmth in your pelvic area? Did you have more morning erections? Did your confidence improve? I want to hear your results, and I guarantee other men will be encouraged when they read your story too. This is how we build a community of men who refuse to accept decline as inevitable. And again, comment below right now and let me know where you're watching from. I read every comment, and I love hearing from you. Let's recap one more time because repetition helps this stick. Pressure point number 1 is Li4, the webbing between your thumb and index finger. Press for 30 seconds to trigger nitric oxide production and increase overall circulation. Pressure point number 2 is P6, 3 finger widths below your wrist crease. Press for 45 seconds to regulate cardiovascular function and enhance blood flow to your pelvic region. Pressure point number 3 is Li3, the depression on the back of your hand behind your index finger knuckle. Press for 60 seconds to directly stimulate your sexual organs and pelvic floor. Put these together and you've got the triple flow protocol, a 5-minute daily practice that can help restore firm, reliable erections even if you've struggled for years. And here's something I want you to think about tonight. What if you didn't have to accept weak erections as just part of getting older? What if you could feel vital, confident, and sexually alive well into your 70s, 80s, and beyond? That future isn't far away. For many men, it's just 3 pressure points away. I know how discouraging it feels to think you've lost this part of yourself. And I've heard the embarrassment in men's voices when they tell me they can't perform. I've seen the frustration in their eyes when they talk about disappointing their partners. But I've also seen the joy when they realize it's not over, when they rediscover the part of themselves they thought was gone forever. That joy is waiting for you too if you take the first step. And that first step is as simple as pressing a point on your hand. Remember this, your age does not define your vitality. Your choices do. And today, with the triple flow protocol, You have the chance to make a choice that can transform your health, your confidence, and your manhood. You deserve to age with strength, with dignity, and with the full expression of who you are as a man. Don't settle for less. I'm Dr. Emily Carter, and remember, health is not about age. It's about action. Stay strong, stay confident, and I'll see you in the next video.